Hi, everyone. My name is Amy Allen, Vice President at the Westchester County Association. It's my privilege to be here with you today in another of our online video chats where we are bringing with us subject matter experts who can share their knowledge and expertise about matters dealing with the current COVID-19 crisis. And before we introduce today's guests, I just want to thank the WCA Platinum Partners, without whose sponsorship we would not be able to produce these programs. My guest today is Kevin Dahill. Kevin is the President and CEO of the Suburban Hospital Alliance of New York State, which represents the hospitals on Long Island and the Hudson Valley. And needless to say, Kevin and his members have been extremely busy in this current time. And before I bring Kevin on, I just want to say on behalf of the WCA and everybody who is watching and listening that we owe such a debt of gratitude to all of the frontline healthcare workers who put their lives on the line to save and take care of all of us. So please welcome Kevin Dahill.
Hi, Amy. How are you?
Good, thanks. Kevin, can you please, I think everybody would love to hear what you're seeing kind of from the frontline view of what the hospitals are dealing with on a daily basis.
Well, based on my contacts with all of our hospital CEOs, I would characterize conditions at the hospitals as being almost like a war zone. And I don't say that in any way exaggerating the conditions. The volume of patients that they've had to take on, and all of the anxiety and emotional stress that has come with this is quite incredible. You know, about 3 weeks ago now almost, the governor issued an executive order mandating that all hospitals in the state come up with a plan to increase their capacities by 50%. That caused the hospitals to have to get very creative as to where they could place patients within their facility or perhaps at alternative facilities. We've even had some hospitals go so far as to convert their cafeterias into patient care treatment areas. So it's business being conducted in a whole new way, and it's put a lot of stress on the system, quite frankly.
I can certainly imagine. Kevin, what about the issue of the supplies that the workers and the hospitals need? How is that holding up?
Right. So this is getting a lot of public. It has been getting a lot of public attention, and there has been an element of confusion that has existed for the last several weeks. As of today, things have stabilized somewhat, not entirely, but somewhat, in that over the course of the last week and a half, more supplies have arrived. The problem we've had is that initially the hospitals were out trying to acquire supplies on their own, and they ended up bidding against each other for a lot of these supplies. We turned to the state for assistance in this, and we've been pretty successful over the last week and a half, whereby the state is going out and acquiring supplies, and the hospitals each day, every morning, have to fill out a form for the state telling them about their capacity and their need for supplies. And then the state has been providing it. Now, the state gets the supplies very often from the federal government, but it's become the most efficient way to do it under these circumstances.
Well, that's good to hear. Hopefully, things will ease up as we move forward. Now, in terms of the workers that you need, I know you mentioned initially, obviously, some of the workers themselves are getting ill and they can't come to work, or they may have family members who are ill. What are you finding among the member hospitals is the biggest need right now in terms of workforce?
Well, certainly nurses and respiratory therapists, and nurses who have some training in critical care are really the most needed. Remember, when the hospitals had to put this surge plan together for the state and increase their capacities by 50%, they also had to figure out how they were going to staff that additional capacity. So that's put stress on the system. Your viewers might have seen in the press that we've got 2 alternative care facilities up and running now in New York City. One at the Javits Center and one aboard the USN Comfort, which is docked in New York Harbor. Those facilities are being staffed by the federal government. Literally physicians, nurses, respiratory therapists from the military. So that's created a relief channel for us, where New York City hospitals, first and foremost, can decant overflow. And then we've had patients transferred from Westchester and Nassau County to those facilities as well. So that's helped from a staffing point of view. But there's no question about the fact we have a lot of staff falling ill themselves, and then they have to be quarantined for sometimes up to 14 days. So that's created gaps. We have 2 initiatives underway in that regard. One is the state put out an appeal a month ago for volunteers, such as retired clinicians and nurses, to come forward. And believe it or not, about 80,000 people signed up to come in and help. Both retired folks here from New York and folks from around the country, quite frankly. So that's been very helpful. And now we're linking the hospitals that need staff with those folks who have signed up. And we're actually doing it through LinkedIn, to be honest with you. And that should begin to help a little bit.
Yeah, that's good to hear. I know we've heard in some of the suburbs, and even actually in the city as well, the creation, again, analogous to a war zone, of field hospitals. I believe there's talk of putting one up at the Westchester County Center, I believe Central Park, and probably on Long Island. How is that going?
Right. So there are plans underway to construct these alternative care facilities, or field hospitals, as you call them. Those are being constructed by the Army Corps of Engineers, but once they're up and in place, they will fall under the responsibility of a local hospital to staff them and supply them. So in the case of the Westchester Convention Center, White Plains Hospital is going to be the responsible party to manage it, but it'll be available to other hospitals in the county, and maybe even further north, to decant some patients. Now, the last several days, we've begun to see less growth in the rate of admissions to our hospitals, and we're keeping our fingers crossed that maybe we've reached a point of plateauing in terms of the growth in admissions. We're also seeing patients getting discharged in somewhat more significant numbers. So we'll see. The good news is we'll have these facilities as an option. The best news would be that maybe we won't have to use them.
Yeah, that would be the best option. Kevin, let's talk just a little bit about some of the financial concerns and considerations the hospitals are facing. I mean, obviously, it's very expensive to take care of these critically ill patients with all the equipment that's needed. I know that elective surgeries, I gather, are not happening, and those probably are a better source of generating some cash. Are you getting the funds from the federal government, the state government? How is that flowing?
Well, the Congress passed a stimulus bill about 2.5 weeks ago called the CARES bill. In that bill, there was an appropriation for $100 billion for hospitals and medical practices and community health centers. I have to say that the government moved quicker than I'm used to them moving on the federal level, and distributed $30 billion of that $100 billion last week on Friday, actually. And what they did, which was probably the most expedient thing for them to do, was they created accelerated payments for our hospitals, and they went back to last year's volume, Medicare volumes and claims data, and they just replicated it. So as to say, if it had been business as usual, you probably would have had this much Medicare activity going on in your hospital. We're going to give you that cash now. So literally last Friday afternoon and into the evening, funds were deposited into hospital accounts across the country, quite frankly. So that helps a little bit. We've been in discussions with our congressional delegation and with Senator Schumer about the next $70 billion, and saying that there should be more of a sensitivity, if you will, to the fact that New York's volume of coronavirus patients far exceeds any other state in the country, and therefore the payments should reflect that rather than just an across the board distribution around the whole country. But we'll see how that works itself out over the next couple of weeks. But that was a relief that all of the hospitals got as of Friday. Cash flow is a major concern. Some hospitals went into this crisis in better financial shape than others, and the ones that were already struggling somewhat now are rendered in a real acute position. The state has been responsive. If we hear from one of our hospitals that they only have a few days cash on hand, the state has stepped up with some relief, and that's been good.
So I know the state did pass a budget on April 1st, and prior to all of the coronavirus issues, there was still big issues with Medicaid, and the governor had convened the Medicaid Redesign Team 2.0. Are the recommendations of that team that made it into the budget going to stand in this current environment? And if so, are they going to be even more onerous to the hospitals?
Well, it now seems like years ago, but it was only months ago that I spoke to your board at the Westchester County Association and also at the Healthcare Consortium about what the issues were. And so you're absolutely right. The state was confronting a $2.5 billion Medicaid deficit in this coming year. They did convene the Medicaid Redesign team. They did come up with recommendations, some of which I predicted might happen and are in there, that are of concern to us as they will affect the suburban hospitals. Because of the circumstances the legislature found itself in, and quite frankly, not wanting to spend a lot of time in the Capitol, they really deferred to the governor. and passed a budget that had all of these cuts in it. The governor and his budget director are empowered by this legislation to execute the plan as they see fit. But the governor has made it very clear that they're not going to proceed to execute anything until after this emergency declaration is expired, and even probably up to a couple of months after that. So, quite frankly, given everything else that's going on, we've had to put that to the side until after this is over. But this issue will come back to us, and I suspect we'll be having discussions at your board again about this.
I'm sure that's true. Kevin, another topic that we at the WCA with you have spent a lot of time on is the role of the health insurance companies. How have they been helping, not helping in this current environment?
They've not been helping. I hate to say it, but, once this emergency outbreak began to occur, I can't tell you how many constituencies I heard from personally, including you, other business associations, elected officials, civic leaders, community organizations, business people, all asking what could we do to help. The one call I did not get was from an insurance carrier, certainly from their association. What I and my colleagues, the other regional executives from around the state, have done is we co-authored a letter that we sent to the superintendent of financial services and to our state delegation, and we've made it very clear that the insurance companies have not stepped up. We've had follow-up discussions with the Department of Financial Services, and I suspect in the next day or so you're going to hear that they are going to put out some mandates that are going to force the insurance companies to step up. What they can do is similar to what the federal government did, is look back on last year's claims experience, replicate it, make advance payments, and we can reconcile this all later. But it's very telling, and your membership has been so supportive of our efforts, so it'd be preaching to the choir in your membership, but it's very telling for the public to see how removed these insurance companies are from patient care at the end of the day. It's incredible.
Yeah, it's something that, as you know, we've spoken for a lot of years about, and I don't know, maybe it's time for the state or the federal government to step up even more and do what they did with the banks and the Community Reinvestment Act and force the insurance companies to at least invest some money back in the community that they do business and make all their money from. So we're behind you on that, as you well know.
Oh, I know.
So Kevin, before we wrap up, any final thoughts? Any lights at the end of the tunnel? Any words of advice for those of us listening to you?
Well, as I said earlier, the numbers in the last few days seem to be suggesting that there's been a slowdown in the growth of new cases being found and admissions to the hospitals. My hope is that will continue. But our hospitals are really taking it on the chin. You'll see on the screen that if anyone was so inclined, we do have a relief fund that we're soliciting donations to. The other thing I would point out to your viewers is that even when this is over and the emergency declaration is expired, there's going to be a lot of repair required in terms of the hospitals themselves as physical structures and the staffs. So, we're not going to be flicking a switch here and going back to a state of normalcy. Even when the declaration is pulled back, it's going to be months and months of repair that's going to have to go on. So we all need to be prepared for that.
Yes, I think everybody's talking about a quote unquote new normal, and who knows what that's going to look like. Again, before we say goodbye, just know how much we appreciate everything that you and your members and the healthcare workers are doing. It's not an easy job, and you have our thanks, and you know, we hope to be able to support you as best we can. And again, before we sign off, I want to again thank our WCA Platinum partners for making this programming possible. We will be coming to you with future programs. You can find the information on our website. We hope you will join our Facebook and LinkedIn groups. The information is there on the screen about where to get the information and how to join our social media platforms, and hopefully you will do that. So again, Kevin, thank you so much for spending the time with us. I know how busy you are, and we definitely appreciate it. So thanks again.
My pleasure. Thank you, Amy. My pleasure. Thank you, Amy.
And to everyone listening, thank you for joining us. We really appreciate your time.